It's 11 minutes after 8 here on the AM show. Now, Ghanaians are generally, we all are getting concerned and worried about the increasing level of insanitary conditions here in our country. Two things that we're doing on the back of that. There's a JoyNews special campaign for a clean Ghana, where Justice Baidu is going to tell the story of Kasoa, where increasing amounts of uncollected rubbish has been blamed for rising diarrhea and malaria cases in the country. Now, when we come back, Nora Olenu is in the studio. She is with Intervention Forum, and they also have the Voice for a Change, which is advocating for government policy on addressing sanitation. That's our next big thing. So here we go first with Justice Baidu's report.
This is the Kasoa main market, one of Ghana's sprawling neighborhoods. Overcrowding and high rents in the center of Accra has now pushed many to come and live in new communities like this. The influx has come with problems like alarming levels of filth. Fatimatu Tairo runs a shop in the middle of the market. Like many, she has recently treated her child of diarrhea and blames that on the filth she and other residents live in here.
The gutter will be full, there will be nobody to clear it, and even if we clear it, there is no way we will dump it. And then if we go to the refuse dump, they will say they will collect 20 cedis or 30 cedis. We don't have money to pay. So some people will go and carry their boiler and come and put it in the gutter.
Fatima's story is not an isolated one. Ghana's economy loses 420 million cedis each year due to poor sanitation, according to a 2012 World Bank study. These costs come mainly from premature death of about 19,000 Ghanaians from diarrheal diseases, including over 5,000 children under the age of 5, nearly 90% of which is directly attributable to poor sanitation and hygiene.
I and the assemblyman
Rufai Ahmed has been volunteering with the campaign group Voice for a Change, trying to get the local assembly to pay more attention to the worsening sanitation conditions in Kasoa.
The problem we have, we can remove all these gutters, but how to collect it is the main problem. When you talk to the sanitation officer to bring the car so that after they remove, they collect. Sometimes they say the car have problems, so they cannot come.
At the local clinic, evidence of how badly this community continues to suffer from sanitation-related ailments. Tens of people line up to receive care, mainly from diseases like malaria and diarrhea.
In 2017, for example, we had over 24,000 cases of malaria, uncomplicated malaria, within the municipality, and 5,000 plus diarrhea cases in all. These are all disease conditions that are directly related to poor sanitation.
The story of Kasoa's growing filth problem, like many big cities in Ghana, is one that is begging for urgent attention. As the clock ticks, the lives of many of its residents may just be on the line. Justice Baidu, JoyNews, Kasoa.
Now, this is our story. It's nowhere close to London. In fact, let's not mention London at all. Let's engage Nora Olenu. She's going to give us, let's just pretend that we didn't know the kind of conditions that we live, even in Accra. Let's get a clearer picture of how it looks like. Maybe we are exaggerating what is happening. Good morning to you, Nora.
Yeah, good morning.
Yeah. What we just saw is Kasoa.
Yeah.
We live in it too.
Yeah.
And thank you. Is this widespread? Are we just making assumptions? Is it just an exaggeration of the sanitary situation?
It is not an exaggeration. It's reality on the ground. You could see that in the course of our work, we've realized that these situations are real. And with the work that we are doing, is an evidence-based advocacy program tackling sanitation. Ghana has a sanitation issue, which all of us are aware of. And then looking at the situation at hand, there are certain challenges that are kind of contributing to this kind of issues that we face. Which one is the weak policy implementation? We have the the National Environmental Sanitation Policy, which needs to be implemented at the district levels. But these policies are not working. They are there, but they are not functioning. They are not working.
Why? Why?
I would say that the reason why those policies are not working is that you look at the trends that we are in, and then looking at the SDGs, you also compare the capacities of the MMDA's officials, the Environmental Health Sanitation Unit or the officers. Their capacity needs to be built or needs to be strengthened in order to implement these policies at the local level and implement it very well. The Policy Act is strategic document. That is the plans and then the action plans and everything. You look at the policy and then what you are supposed to do at the district level. From our course of work, what we've realized is that out of the sanitation policy document, we have the National Environmental Sanitation Strategic Document too. And then out of it, you come to the district level, they have the DESAP, that is the District Environmental Strategic Document.
Okay.
Okay. Which the environmental health officers are to work in line with those guidelines. And you look at the guidelines, if we want the sanitation to work or to improve the sanitation at the local levels, then that DESAP document needs to be functional at the district levels. We realize that there is this component of the M&E plan that the assemblies have to kind of develop, which is part of the guidelines. The environmental officers just develop their plans, the development plans and actions without M&E plans and then budgets, okay? Also, the assemblies, from the look of things, they are saying that they are lacking funds, okay? The common fund, even the one that comes, there is a lot of deductions at the source, okay, to Zoom Lion and other waste management. Yes,
we've engaged people that they actually don't even see on the ground.
Yes, okay. So this kind of deduction from the assembly's perspective is affecting their implementation, because you do the plans, they will design their plans and everything, but when it gets to the release of funds, what they hear is that we don't have enough funds, or the funds are delayed, okay, or whatever they get, then they have to prioritize. So you have a whole document as a planning document for sanitation, but at the end of the day, as an officer, you just sit down because there are no funds. Okay? So the situation has to do with capacity, it has to do with financing, you see? It has to even do with the collaboration, the coordination at the local level and the substructures.
So, you know, we know that the president is whipping up all these enthusiasm, trying to get all of us to get a cleaner city, clean wherever we are. It will come to nuts if all these issues that you're outlining are not addressed. So how do you say we tackle this? Where can we begin from?
Okay. We've seen some commitment and some actions from the government angle, okay? The government just launched the National Sanitation Campaign, and with some about 11 key highlight messages, okay? One is about the National Sanitation Fund, the creation of the National Sanitation Fund. Even that one is even in the NESAP, that is the National Strategic Document for Environment, okay? Which districts assemblies also are to create that fund to kind of be a resourcing or kind of a backup something in case there are issues at the assembly or funds are being delayed. You have this kind of fund there that you can just fall on and then continue your implementation, okay? So you look at the key messages that the government has highlighted as the campaign messages, okay? For it to be effective from our angle, there should be a very strong leadership commitment.
There is a strong leadership commission. We know that the president is committed.
Yes.
He's been strong about
yes.
it. So what else do we want?
We need action. It shouldn't just be.
So action is what exactly?
Taking steps, putting the measures or the mechanisms in place so that those kind of key highlights, messages, whoever is in charge or whoever, which institution will take over whatever campaign message to or advocacy thing to kind of make sure that thing becomes fruitful. Then that person needs to, there should be some guidelines, some modalities in terms of, let's just pick the National Sanitation Fund. If you are creating that, are there clear defined roles? Okay? Will there be prudent financial management? You see, all those things need to be looked at. It's not just
so should the president be looking at all these things? Because he has a lot of men in line, a lot of men and women to be undertaking.
Yeah, I would say from the CSO's perspective, and that is our Voice for Change thing, we've been able to form Alliance for Wash Advocacy.
Okay.
And then during the president's launch of the National Sanitation Campaign, what we did was that we came up with a communique. Okay, this communique has some kind of highlights or some recommendations looking at the specific messages that are there. So we're able to kind of, you can check online, I think, graphic online.
But did you hand it over to any authority?
It was online.
Okay.
Yeah, and then secondly, we presented a memo to the Minister for Sanitation and Water Resources on 3 main issues: the policy review and harmonization, the provision of adequate financing, and then end open defecation with some detailed recommendations.
Are you seeing reflections of your recommendation in their work today?
I would say that, you see, recently the government, in terms of financing, has added additional 2 million to the sanitation budgetary allocation, the 280, the 2018 budget. Okay, so it's running up to 383 point something million. Okay, but even with this allocation, our fear is that is the ministry very strong enough to be able to utilize these funds within this 2018. Okay, because from 2017 we realized they were not able to kind of use all the 2017 budget that was allocated. We know it's a new ministry, they are doing a lot, and they are responsive. Whenever you go there, they receive you. Okay, so for all these things to come into fruition or for it to be successful, a lot of things need to be considered. Yeah.
Okay. All right. So what's up next with your campaign specific?
Yeah, with the Voice for Change thing, the Voice is tackling 3 strategies: capacity development. Under the capacity development, the CSO's capacity is being developed. Okay. Okay. And then we do onward capacity training for our community level committees or volunteers, and then the MMDAs, the traditional authorities, on their roles and responsibilities.
So this is something you've started?
We started. We started 2016.
Okay.
Yeah. But it's a 5-year project.
But are you encouraged, because we still talk about the fact that the debt, the filth, is unbelievable. So if you started this 2 years ago, then are you making inroads? Are we getting somewhere?
Yeah, we've seen the responsiveness of the assemblies.
But clearly that hasn't been enough.
Yeah, it hasn't been enough because they are facing financial challenges. Okay. That is the main thing. So, for us to solve the sanitation, we need to inject investment into it.
So it comes back to the money.
Yes.
So even with the allocation that you talk about, that the sanitation ministry has received, that won't be enough to fight this.
No. It's just a step in something. Yeah.
So if we give ourselves either targets, I mean, at the end of 2018, what can we do?
At the end of 2018, I think we will be able to intensify education. will be able to...
Well, you think the ordinary person doesn't know what is right and what is...
They know, but you will be surprised. We did a baseline survey, okay? And up till now, citizens believed that it's the responsibility of the government to provide them with toilet facilities. So it's not about we sitting up there or we being at the assembly, okay, planning and designing for the citizen without engaging them. The citizens' engagement in the design and the planning and implementation of the sanitation or the wash intervention is very important.
Is this also not compounded with the many promises that politicians themselves give to the people? Because if you come and you say you fix all my problems, I don't have a toilet, but you make it look like you can provide me with a... In fact, we've seen governments and other officials commission toilet facilities.
Yeah.
So you paint the picture that it's your job to provide toilet facilities.
Yeah. So you see, I'll take you back to the sanitation situation. 97% of all our public-owned and public-managed sewage treatments, they are not functioning. Okay? They are not functioning. And if a citizen should be in the house and thinking that the government has to provide toilet facility, meanwhile, it's the responsibility of that citizen. Okay? And then where the government can come in also is when you look at the poor, we have the poor at the community levels. Okay? How are we even identifying them and then involving them? The inclusiveness in the wash interventions to cover them. Okay? The politicians can make a lot of promises, but I'm telling you, once we empower the citizens, they will know that they have to demand for certain things. Okay, you are saying this. Okay, what are the timelines? At the end of the day, or whatever you provide, or whatever it is, no. Okay, what would be? How would the sustainability of the whole thing?
Sure.
Okay. That
So
one also counts. Okay.
Okay.
And if we don't do kind of citizens' involvement, the ownership, the promotion of the ownership of toilet facilities, or the citizens knowing that it's my responsibility to make sure that my city or my area is clean, or the drain in front of me is clean. You see?
I get you.
Yeah.
I get you. But now there are, just before we wrap up, there are many, there's the sanitation ministry, there's also the assembly.
Yeah.
So who is our first point of call? Who do I report to from what you've seen? If Zoom Lion, for instance, is not picking my refuse, who do I call?
Okay. So at the district level, what we have done is that to create a coordination platform where we bring together the waste management firms, those that are operating at the district level. So I would say that it's for us to create that kind of, because there is no coordination, there is no collaboration. Okay? Environment can report to itself, planning can report to itself. There is no coordination. Zoom Line had to report to environment and then to the assembly. But you see that there is kind of gap in that coordination. You see?
Yeah.
So as CSOs, we need to kind of look at that angle where we can strengthen those collaboration and coordination, create those platforms for them.
Yeah.
And there should be one time a joint monitoring at the district levels.
Yeah.
At the national level, let's engage the ministry on the issues that are coming up from the district levels.
Yeah.
If we're able to address it, then we'll be able to promote our sustainable sanitation.
This is one of, just like we're having many conversations on sanitation.
Yeah.
So we will definitely be talking again, and we'll be monitoring the situation alongside with you. But I'm grateful for your time, Nora, this morning. Nora Olenu is Chief Executive Officer, Intervention Forum, and we've been talking, of course, about this big headache that we are targeting this time around.